begin today's celebration, and we do remember Clare. We know she is sleeping peacefully, waiting for God to take her home.
A tiny town in disbelief and in prayer for one of its long-time residents. 95-year-old Clare Nowland is receiving end-of-life care after being tasered by police at her home of 5 years, the Yallambee Lodge Aged Care Facility in Cooma.
It's an awful way to finish what's been a great life.
Clare is a mother of 8, grandmother of 24, great-grandmother of 31, and has been a carer of so many more.
She was very prominent in this parish, prominent in the areas of charitable works, St Vincent de Paul, and as somebody said yesterday, who one of the ladies, the town said, an absolute gem.
A 95-year-old great...
What happened to Clare in the early hours of last Wednesday has made international headlines.
To Australia now, where there's been outrage after a 95-year-old woman was tasered by police, leaving her critically ill in hospital.
She was struck twice before she fell, suffering a fractured skull.
The knife in question was a steak knife, a serrated edge knife. At the time she was tasered, she was approaching police. But it is fair to say, at a slow pace. She had a walking frame, but she had a knife.
New South Wales Police rules for taser use say they should only ever be used on elderly or disabled people in exceptional circumstances, when a reasonable person would believe it was necessary to prevent harm to themselves or others. The officer who allegedly fired the taser, Senior Constable Christian White, has tonight been charged with recklessly causing grievous bodily harm, assault occasioning actual bodily harm, and common assault. But questions have been raised about why police were called to an aged care home in the first place.
In the 30 years that I've been in aged care, I've had cause to call the police once.
Yallambee Lodge, where Clare Nowland was living, was audited earlier this year and found to be fully compliant with the aged care quality standards. Professor Rodney Gillette has worked in the aged care system for decades and now runs a specialist dementia home.
If that was the case, you wouldn't have incidents like this occurring. So it really calls into question the auditing process and the accreditation process for aged care.
A look back into the audit records of the facility, however, shows a history of non-compliance. In 2018, the aged care regulator issued a serious risk decision, finding that Yallambee Lodge had placed the safety, health or well-being of a resident at serious risk. It's unclear from the records what sparked this finding or how it was resolved.
There's no detail at all about what the reasoning behind that decision was.
In 2020, Yallambee Lodge was re-accredited, despite auditors finding it was non-compliant in 7 out of the 8 standards. This included not having an up-to-date policy relating to restraint minimisation, not effectively managing residents with challenging behaviours, and failing to conduct assessments to identify whether dementia patients were in pain. By the end of 2020, the home was assessed as fully compliant with the standards and has remained so since then.
We can see homes that are audited and pass, and then several weeks or several months later they're audited again and they fail, and then someone comes back and they pass again. So it's a very subjective process that is woefully inconsistent.
The Aged Care Quality and Safety Commission is investigating the incident at Yallambee Lodge and says if the provider is found not to have met its legal obligations, it will take action to hold them to account. In a statement, the Commission said that further work is underway to increase transparency in the sector, including implementing the new star rating system. Yallambee Lodge is today rated 4 out of 5 stars. The Royal Commission into Aged Care expressed deep concern that so many service providers didn't have the skills or capacity to adequately care for people with dementia. It found that dementia care should be core business for aged care providers.
In the current environment, it is not mandatory for people to have dementia educations.
Dementia Australia runs education programs for aged care staff and first responders, which includes virtual reality programs to show how people with dementia may experience the world. Dr Cale Stokes says the focus of any dementia education needs to be on de-escalation.
So it's really important that there is a focus on the individual, removing obstacles from their way, making sure that people around them are safe as well as the person themselves, and focus on how to de-escalate that situation.
In a statement, a spokesperson for Aged Care Minister Annika Wells said the government funds a dementia training program for eligible care workers, and the new Certificate 3 in Ageing will include mandatory components on supporting people with dementia. She said her thoughts were with Clare Nowland, her family and all those impacted. Clare Nowland's family have described her as their fun-loving and gentle matriarch, a well-respected and much-loved member of the community left trying to understand what happened.
Cheers, Nana!
Thank you.
Cheers.
Cheers to everybody.